Terminology gets a little difficult with all of this in the medical field. I said bio. I'm looking at a thing we're going to be talking about today, but bivalent as opposed to monovalent.
The bivalent shot actually has the original strain in there, and then now this new one has the new strain, so like the Omicron and subsequent strains. So it basically what they're saying is that it's covering more strains versus the original strain. That's what the bivalent is.
Okay. You have a success story. First of all, we're going to use the term biostacking, and you might explain, if you will, Dr. Meyer, exactly what biostacking is.
I'd be happy to, but I would be remiss if I did not follow up a little bit on that bivalent aspect.
Okay.
So the bivalent, I really encourage everybody to do their due diligence, get proper informed consent, and do the research on anything that you do for yourself from a healthcare perspective and in life. So, and I am pleased to have that discussion with you personally. Anybody in our clinic is, whatever that medical procedure or process or vaccine may be. If you wonder if this is right for me, what are the risks? What are the upside, downside? I would be remiss in saying that I am not happy to go further and kind of share my experiences over the last 2 to 3 years of what I've seen as it relates to the COVID vaccine. So, but it's been a journey, and it's led me to some happier things along the way. Some of these success healing stories, including the biostacking, and so some of the COVID injury, we're using biostacking to help it. And again, biostacking is essentially using multiple modalities to help the body get on the right track for healing. This success story that we had, my colleague, nurse practitioner Ellie, she was with a guest a couple of weeks ago, and this individual was having trouble sleeping on her right side at night, and we determined that she had some hip bursitis, and that was keeping her up at night. Most times you can't lay on that right side or that left side, whatever hip's bothering you, and that's pretty miserable. And it was also affecting her fun. She liked to go out and dance, and so she was not able to do that. So you come in traditionally, she came in for an acute visit, saw Ellie. One of the things we would typically offer would be an injection, a steroid injection, and that of course is still always an option. We can do that. There are some downsides to that. Who really wants to have a needle stuck into their hip? Probably not everybody's first preference. So to know that there are other options available is a kind of a nice thing that are effective for many people. And so this gal, Ellie, got her going on a PEMF, which is Swiss technology, and red light, near infrared light therapy. She did 3 sessions each of these, and this individual went from pain to no pain and dancing, line dancing, within those 3 treatments. So that's without a needle. So, a lot of people are going to want to try some of those options first, and it was super, super helpful for that individual. And, so this is what we have at the clinic, in addition to the hyperbarics and our functional medicine team, direct primary care. We're gonna use these different tools. As I always talk about, tools in the toolkit. Mm-hmm. And so it's a PEMF pad, and that technology is emitting, you sit on it for 15 minutes thereabouts, and it's emitting a gentle frequency that helps circulation, it helps inflammation, and it helps cellular recovery. And so, in fact, I've got somebody that's had an ulcer now for many years that he is part of his treatment with hyperbarics is biostacking, using the red light, and he's also using this PEMF pad. The red light therapy, which you stand in this bank of red lights, and it's near infrared light, red light, and our body craves this stuff. We need this stuff. It is amazing. So you're in there for 15 minutes, and it stimulates the mitochondria, which produces ATP or energy, helps with inflammation in the body, and it provides so many other amazing things from a mental health perspective, from a skin collagen deposition perspective. We even have folks that come in for sinus infections that they do 15 minutes of the red light, and instead of knocking out their entire gut biome with an antibiotic, sometimes we need to do the antibiotic, but some of them want to try the red light first and see where they get with that, and we've had tremendous success with that. So super exciting to have these options available in our area, Northwest Iowa, and kind of this approach that's being embraced around the country and around the world. You've got Dr. Peter McCullough. He's got the wellness company, and he's out there saying the same thing. He's like, a new dawn is coming when it comes to healthcare, where we're looking at not just disease management, but wellness. We're looking at how can we get to root cause and help quality of life and not just put Band-Aids on. Let's use all the tools in the toolkit. So that's what our team, we're happy to answer any questions along the way to get you there. It's a journey. It doesn't happen overnight. We didn't get into these debilitated states overnight. It took a while. And so we ask that, it's your part of the equation too, is taking that walk, that journey together with us, putting the time and effort in. But it's a lot of fun. And our team is so excited. Amy Swanson, Ellie Stokey, our functional nurse practitioners, and then our functional nutritionist, Molly Avery, is a wealth of knowledge. We have so much to offer in a time when so many people are thinking, all right, I don't want to keep adding another prescription medication, Let's see if we can do a little bit of a different approach. We're happy to help you in that effort.
That is so true. I think a lot of people are in that boat where they do not want to take another pill. But I think one thing that you're doing, and I love the story that you told of that elderly gal that came into your clinic, and she had been told that you're going to have to live with this. And it had to deal with, I believe, her lower extremities not working properly as she wanted them to. And she came to see you, and she says, I'm just not going to accept that.
Right. Absolutely. I love that. I love that fight. And she wasn't going to accept it. So much of that is mental, and we are energy and, God's love and light. And if you have that positive energy and attitude like she did, and you pair that with some of the different treatments and options that we have, she defied the odds, and she her sciatica or foot drop went away. So came in for COPD, and the foot drop went away with the hyperbaric treatment and the PEMF pad. So pretty incredible.
Well, and you're absolutely right to have people, when we talked about the monovalent and the bivalent COVID shots, to do some research, see which category you fall. There's so much research out there now. I just ran across another thing with vitamin D today.
Right.
Vitamin D, it was, and I guess hindsight's 2020. But vitamin D, big, not stupid doses, but a pretty good dose of vitamin D would have done extraordinarily good to a whole lot of folks in the last 3 years.
Absolutely. And I encourage you, do the research, ask your doctor. Ask your doctor before, about these early treatments for COVID. And because what, our guests and patients are teaching me every day too. So that's a good thing. They come in and say, hey, doc, I read about apricot seeds, vitamin B17 and cancer. I'm like, okay, I've never heard of that before. So I looked it up. This is how we grow. This is how we learn from each other and move the ball forward in wellness. And so that's part of it too. It's educating your doctor and saying, hey, doc, what do you think about vitamin D? What do you think about things like ivermectin? What do you think about the different shots that are out there? What are the risks and benefits? And do your research and say, I'm seeing this. Is this troubling to me? Well, share that. If it's troubling with you, share that with your doctor and have a conversation.
Seems like sometimes we're just surviving.
Right.
You're helping people live, get the most out of their day.
Absolutely. Survive. We want to thrive.
There you go. All right, where do people find you?
You can find us at phone number 712-339-6024, online, okobojiwellnessclinic.com. Call us if you want to make an appointment to see one of the functional medicine providers, functional nutritionist, or if you need a hyperbaric consultation or just a regular routine acute or adult visit, family medicine, we're happy to take care of you.
Very good. Always a pleasure. Dr. Bradley Meyer, Okoboji Wellness Clinic. You can find him at okobojiwellnessclinic.com. You can make an appointment today and start living life like you want to live it.